Carpal tunnel syndrome. Definition of carpal tunnel syndrome. Carpal tunnel syndrome is a progressively painful hand and arm condition caused by a pinched nerve in your wrist. Bound by bones and ligaments, the carpal tunnel is a narrow passageway about as big around as your thumb, located on the palm side of your wrist. This tunnel protects a main nerve to your hand and 9 tendons that bend your fingers. Compression of the nerve produces the numbness, pain, and eventually hand weakness that characterize carpal tunnel syndrome. Treatment for carpal tunnel syndrome. Start treatment on the back of your hand at the wrist and work the entire area from your wrist to the ends of each finger for a total of 1 to 2 minutes. Now work from your wrist up to your elbow, covering the entire forearm area, the sides, and the underside of your arm. Stop for a moment and see how your pain and movement are. Now use the LTO on the palm side of your hand, running it along each finger to see if you can feel a tingle in each finger from the E-stim. If you're still having pain or numbness in any finger, work the LTO from your elbow up to your shoulder on the top of your arm. Finish the treatment session by treating the scalene muscles in your neck. Treatment times per day. Treat once per day for 5 days and then as often as needed for maintenance. Footnote: the impingement, which causes the numbness or tingling associated with carpal tunnel syndrome, is typically a result of overusing the hand, wrist, and arm muscles in repetitive motions. This causes the tendons that go through the carpal tunnel to get congested, thus causing pressure on the nerves, which results in the associated numbness and pain in the hand. The area of impingement of the nerves can be located by turning up the E-stim and stimulating the wrist in the middle and thumb side, as well as the pinky side, to see if the current is transmitted into the hand. If one or more of the branches are impinged, no current will be sensed into the distribution of the nerve branches into the hand. This locates the area, and now the E-stim should be decreased to just a tingle or less, and the area should be stimulated for 2 to 4 minutes or retested. This may have to be repeated several times over a period of days until the impingement is opened up.